Live. Here we are with Alan Schmoily.
Hey.
Alan Schmoily. So here we go, yo. Here we go. And so I don't get copyright claims. I can only play less than 10 seconds of that. And here we go, yo. So Alan is up in Richmond Hill, Ontario, just north of Toronto, if you don't know where Richmond Hill is. Tell the folks about yourself. I know I'll go off the most important thing, data 4. That's impressive. That is impressive. Data 4. Four little kiddos.
Data 4. Yeah.
What are the ages?
9, 7, 3, and my littlest one just turned 1 year old.
Do you remember all their names? Is that no?
You abbreviate it.
Yeah. That's good. So Alan and I met in the American Physical Therapy Association, APTA, the governing body of the physical therapy profession, and you were the president of the students.
President, yeah.
The student, two years before. You were before James.
Yeah. You
were the year before James Spencer, who we know, and then my year was Evan Nelson from Duke. Shout out to all those guys. And so that's when we met. That was back in 2006, 7, something like that.
4 or 5. 6.
For you were the president then. I was a student. 05, 06, yeah, something like that. So anyway,
testing my memory, going back.
Yeah, man. So jumping forward to today, here we are, 2021, January. And anything else we should know before we get started? You're up there. We'll talk a little bit more about the all your hashtags and Instagrams and all that stuff at the end. But and it'll be in the show notes one day. I'll get to that. But you're at Premier Spine and Sport out there, and you guys are a multidisciplinary approach, and that's kind of what we're gonna touch on. Yes.
Yeah, absolutely.
And board certified OCS, so orthopedic certified specialist, which is a pretty big deal. Pretty big.
Apparently found out there's only 4 of them in Canada. So 1 of 4.
Well, that's because it's more of an APTA thing in America.
It's the
Canada has
its
own. Yeah.
Canada has its own. It's a newer one, but I just got my 10-year recertification. So
congrats.
For 10 years and just recertified.
That's very cool, man. That's very cool. So he's a smart fella. That's why we're talking today. So this is Bono stuff. And as much as I think I know sometimes, I like to bring on people who can teach me more stuff. And today we're going to talk about chronic pain is the title, but as we were just talking before we started, we don't love that term, and we're going to go into it. So tell us a little bit definitions and why we don't like that term, and go into it, man.
Well, I think chronic pain in itself has a negative connotation. I get a lot of people who, if I was to describe them as having chronic pain, they would flat out deny it. But the technical definition is having pain for more than 3 months. So, there are a lot of people who do fall into that category. But again, because of its negative connotations, we just like to say that they've had long-standing aches and pains that they haven't been able to figure out yet. Maybe they've been to several providers, and at best they've got temporary relief and sometimes not. So it really ranges, and we can definitely dive in and talk more about, specifics about it.
Yeah, for sure. And I would say that's ironically, again, I don't think of it as chronic pain either per se, but the majority of folks I end up working with and getting committed to my longer term programs, as far as, so I the way my business works, for Alan and for anyone following, I like the performance side, which Alan and I have also spoken about, of a continuity program. So if you have somebody who's finishing an ACL rehab kind of protocol and they're getting back to sport and things like that, now we can focus on the fitness side of it, and that's where I kind of touch those lines. But also when people come to me when it comes more to pain, I'm not a traditional, I have back pain or my knee hurts, can you help me? It's more, I've tried 10 other things, and like your approach seems a little bit different. It's something jumped out about your approach, Bo, and what can we do? So a lot of, for me, is that tendonitis, those kinds of things. And again, most of the traditional healthcare system, I'll say, and I'd love to hear the differences, Canada versus the US, which Alan knows both of those systems pretty well, I assume. And I'd love to hear the differences there. But yeah, for me, a lot of folks come to me when they've already tried, 5 different providers. I went to an orthopedic surgeon. They gave me x-rays, MRIs. They talked about surgery. They did some injections. It didn't really work. My CrossFit coach tried to have me modify this, that, or the other thing. I've gone to a chiropractor. I've gone to a physical therapist, and then it's like, well, what are you going to provide different? So I definitely am a big fan. I'm going to say this up front, and I'd love to hear how it all kind of comes back to it. And then I'll let you go of I'm a big fan of load it. Most people do not load enough. When you get stronger, when you build that fitness, when you get confidence with your body, that to me is the long-term cure. I understand people have that, if someone comes in with 10 years of pain, of again, aches and pains, and I say, hey, we're going to deadlift, 200 pounds today, that might be a bit of a disconnect, but that's my goal, is to get that person, even if we start with 20 pounds or 5 pounds, that eventually I think that most people can very easily deadlift, or whatever the movement or the loading is that we need to do. So that's kind of my thing. But let's come back to you what do you kind of see? What is that progression? What kind of diagnoses are we talking about?
Yeah, it's a very similar story that I hear with my clients, and I think it's fairly universal. You have people that, you get an ache and pain, and the natural tendency for most people is to ignore it. Wait and see. Let's just, I might have just, bent the wrong way. I sat too long. They make excuses for it. And then they just try low-cost, simple solutions. Maybe it's an over-the-counter rub. They grab their favorite, painkiller, or they'll go for a massage. And then the next step might be physio or chiro or a visit to the doctor. And that kind of leads to a spiral, like you said, where they're going to multiple doctors' appointments, trying to figure out what the problem is, getting imaging that may or may not be needed, getting, harsher medications or injections that may or may not be needed. But meanwhile, no one really sat down to listen to the person's problem and figure out exactly, what is the source, the root cause of the problem. So when I hear someone who's been to so many different providers, the first thing that stands out to me is whatever they've been working at. I look at it as a positive. We already know what's not working, and we already know what they've been trying. So that just narrows it down, the focus on what I need to look at. And, the first thing is really to hear the story, start from the beginning. And a lot of times these people who've had their pain for, 2 years, 5 years, 10 years, they haven't really had an opportunity to get their story heard for the most part. They're rushed through quick medical appointments, or their providers are spending, very minimal time with them. So the first thing we do is really spend a lot of time just listening to them and listening to their story and figuring out exactly, what's going on there. And from there, we develop our goals and our strategies together. So for some, it may be to deadlift 200 pounds or whatever it is they want to get back into the gym, or an active lifestyle. And for some, it might be, they have a 2-year-old kid, and that car seat weighs 40 pounds, 50 pounds with the kid, and they have a hard time getting it in and out of the car. So whatever the goal is, as far as the end result, and then we just work our way up to it. But you're exactly right. I think the loading strategy and gradual approach to loading is one of the best ways to start working at this problem. Once you figure out what the root cause is, you manage the pain, you manage the inflammation. At that point, usually there is no inflammation. You get that mobility back, and you start working on strength. And that's where the tough part comes in working with people who've had longstanding aches and pains, is because at that point they're afraid of movement. They're afraid. They've got either ingrained beliefs that I've had this problem because I bent, so I shouldn't bend, or I think bending and lifting this is going to.
Or they've been told by a medical provider.
Or they've been told.
Don't lift anything more than 10 pounds or whatever, you're going to flare up your back pain.
That's right. So they've been giving very strict guidelines by a doctor. Don't lift, don't sit, don't push, don't pull. So they have this fear. And the first thing really is to start gradually eroding at that fear by giving them small wins, giving them things that they can do, that that they can do, challenge them, challenge their beliefs, and from there just build that tissue tolerance. Because again, it's like any other system in the body. It's very resilient once you challenge it the right way, right? So heart muscle gets stronger with cardio, and physical muscle gets stronger with resistance exercises. And likewise, a lot of this pain can be eroded when you challenge a lot of these beliefs.
Absolutely. Yes. Yes. That is the right. I mean, we're 100% on the same page with all that. Yeah. I mean, again, most symptoms, and I understand, and I don't think any of the providers that they've seen before are necessarily, you know, doing the wrong thing per se, but they're just chasing symptoms. And that person comes to them, they say, "Hey, I have back pain. Okay, well, let's inject you. Let's, try to get rid of that back pain." And it's much more complicated to say, let's get you in here for whatever it is, twice a week for the next 6 weeks. And each time we're going to work on moving a little bit more and loading a little bit more. And we're going to start with 3 pounds, and then we'll go to 10 pounds, and then we'll go to 20 pounds, or whatever the progression is. But that, to me, and it sounds like to you as well, is the right answer. Of no one's taken them through this and gotten them out of that cycle and empowered them and built confidence, versus, again, most of the system is, I'm not going to be there with you as a medical doctor. You see your medical doctor, you tell him you have, significant sciatica, let's say, because that's a common one, right? And it's like, you have sciatica, rest it. You could try this stretch. You can maybe go physical therapy, or physio, we'll say, for the Canadian listeners. And that's the term I use also. But yeah, you have that system, and the doctor saying that, and it's not always. I don't know if you found, and you're working into that referral network of educating even the medical doctors, the orthos, orthopedic surgeons around, saying, hey, like, if you send these people who are coming to me, like, I'm going to put them into this system, or is it just like, we got to hope that we find these people and we're doing the marketing? But do you have doctors that are sending them to you with the knowledge that you're going to load them and be the Sherpa to take them from, this kind of traumatized, almost painful situation to empowering? And that is ultimately what I think, is the real thing. We need to empower these patients.
Yeah, we do have some physicians that definitely know about us and our system and how we work, and they kind of send the people to us as almost a last resort before the specialist. I mean, in Canada, the wait line to see a specialist is quite long. You can send in a referral to see a specialist, and then you might not get a call back till months later, and at that point you might even forgotten why this doctors group is calling you. So
yeah,
having that physio in between to kind of sort out the problems and get you moving and working towards a solution. And if you need it at the end, that specialist appointment's waiting for you. But for the most part, a lot of times we can figure out what the source of the problem is and start and start helping you. I always say it's a lot of and you can't blame, a lot of the family physicians or even general physios, because when you graduate, you're graduating any profession as a generalist, right? Your schooling is really designed to give you the breadth of knowledge of your craft. But from there, doctors specialize into orthopedics and pediatrics and geriatrics and neurology, and lawyers specialize, and physios can specialize also, like I have, to into orthopedics, to really hone down the clinical skills required to work on these more complex problems.
Yeah, for sure. Yeah, so that's great that you have those doctors, that recognition, and that's the other thing that I think is a little tricky that I've seen recently. Are you guys somewhat cash based, or are you also insurance? The way it works up there, I think you told me.
For the most part, there's some extended health coverage. And insurance and cash pay. There's a mix. Yeah, absolutely.
Yeah, and again, I don't know if you have numbers on this, and especially we've both been in the sort of advocate space before for the profession, and I think these numbers are always a little tricky to come by. There are some research studies I'm aware of. I don't have the numbers on top of my head, but the bottom line is, for me, and I'd love to hear if you have any kind of pitch on this in terms of marketing it, of saying, hey, when you hear those whispers in your body, when you have those aches and pains, whether they've been there for more than 3 months, as per the definition of what chronic means, or they're just kind of hanging around, and you're an active person and you want to avoid this, it's going to save you so much time, pain, disability, energy, everything, and avoiding all these money, for sure. If you come and pay whatever it is to me right now, whether it's to see a specialist, to get assessed, to maybe, again, empower you, and like you said, people are chasing and they're looking for the easier fix, and that's that lizard brain, and I can't blame them. I know of a recent study that I was on a webinar from the Evidence in Motion folks, and they cited a study talking about when someone has back pain, physical therapy was like fourth on the list of who to go see, right? You have orthopedic surgeons, you have chiropractors. I think acupuncturists and massage therapists might have both been above physical therapists, and only like, I think it was 8 or 7% of folks even thought of physical therapy for their back pain, which is just a terrible job of our profession. But yeah, I guess, do you have anything in that regard of like, how much would you pay to be out of back pain? And like, I'm the one who can get you there.
Yeah, there's a lot of literature and research looking at obviously looking at the healthcare system and how we can improve it as far as cost and efficacy. And there's a lot of research showing that when you get physio first, it does help save both the system a lot of money, because in unnecessary physician visits, unnecessary imaging, medication costs, and lifestyle changes. But it also leads to improved outcomes, because you're getting into proper care much earlier on, when things are more easier to change, right? Rather than months later when it's much harder. There's also, you mentioned that study that was quoted by Evidence in Motion. That's just an identity issue with physio, where a lot of people, when they have back pain, they might see a chiropractor or want to get a massage first and then think of a physio maybe fourth. But there's also another study out there that shows that again, board certified physiotherapists are second to only special orthopedic physicians in being able to properly diagnose an issue. So, if I had a choice of waiting 6 months to see an orthopedic surgeon or an orthopedic physio to figure out what's going on and start working on it sooner, obviously I'd choose the latter. Yeah,
for sure. And along those lines, if somebody does come to you and they're complaining of pain and they have not yet had an MRI or an X-ray, and they come to you, and I mean, I don't mean to put you on the spot with this, but but I do. This is not legally binding. But what is your take on getting imaging versus getting again the assessment from a specialist, what's the take on that?
I love it when people come in with images, and I tell them to bring their images with them. But I also tell them that I'm not going to look at it until I'm done with my assessment, because two reasons. One, I don't want it to color my entire assessment, because if I see what the imaging is, it's a halo effect. That's what I'm going to be looking for the entire assessment. It wouldn't be an objective assessment at all.
Well, my question is, just to be clear, is if they're debating it. I'll lead it with my own bias, I guess, and say.
I hear what you're saying. I'll get into there. Yeah. Okay. And the second reason it's more selfish is because I just I'm constantly challenging myself. So I'd love to get to my diagnosis, then look at the report and see if it matched. But to answer what I think you're asking is, if someone was debating it, I would tell them, look, the imaging really isn't going to change much of what I'm going to be doing with you. I've already done my assessment. I can already see the issues, limitations, joint restrictions, muscle weakness, neurological problems, or whatever it is that's feeding into this problem. The imaging may or may not agree with what I found, but there's also a lot of studies that show that there are people walking around who have herniated discs that don't even know it.
72% is always the one that gets thrown around.
Yeah, look, there's already so many studies that have been reproduced by universities around the world that have just taken people through MRIs that are asymptomatic. They have absolutely no symptoms whatsoever, and they looked at knees, they looked at shoulders, they looked at backs and necks, and they looked at every joint. And they can predictably at this point say, if you're over the age of 55, chances are you have arthritis, or stenosis. If you're over the age of 35, there's a good chance you've got a herniated or a bulging disc. There was a small percentage of people that even had fractures, but these people had absolutely no pain. So the question is, if I put an image in front of me and it shows a problem, that may not be the source of your pain or problem. Right. So when we look at people with this imaging, and the imaging does a secondary damage in that the person starts believing into that this is the cause of my pain, this is the root of my problem. But what if we went through a treatment program, you got rid of all your pain, and then you got an imaging again? Chances are the image wouldn't change, but your pain is gone.
Absolutely.
So was that the actual cause of your pain or not?
Yeah. No, definitely. That was my leading question. I definitely want to.
I'll just finish with this. You know, it's very similar to if I took a picture of you right now. All I can infer is that Bo's got a beard and he's got a blue and white shirt on right now, and he's got perfectly coiffed hair. But I cannot infer from that photograph what his personality is. Is he in pain or not? Is he happy or not? Is he hungry or not? I can't infer any of this stuff.
I am hungry.
That's what an X-ray is doing, or an MRI is doing. And the secondary thing is, most of my patients, when they have back pain when they're moving, when they're sitting, when they're standing, when they're walking. But this image is taken in a very static, lying down position where they usually don't have pain.
Yeah. There's a lot of and again, that costs the system a lot of money, the insurance companies a lot of money. Sometimes it doesn't have direct cost to the patient, which sometimes throws it all off, but not realizing that the more often we're getting those images, it's just costing everything more, and it's perpetuating. And again, then it becomes, I have a disc, I have a herniated disc, so now I am that diagnosis. So going back to the language bit there, for sure. So yeah, I think we're both in the school. I say the same thing again with my leading question of it's not going to change much of what we do. You know, you can go get it if it doesn't cost you anything, if you know, like, if it makes you feel somewhat better, but I'm like, it's not likely going to do that. Again, if you're a 72-year-old, you know, you're going to have wrinkles on your face, and those wrinkles aren't necessarily, they're a sign of aging. You've lived a life. That's a lot of smiles, probably, that you've had good times. That's what that's a sign of. But you know, and you're going to have those same kind of degenerative age things. And I think also, you're probably a little more, being the orthopedic certified specialist, you're probably a little more up on this concept. Was it recently that I forget which organization it was, but they said to that medical providers should no longer use the term degenerative disc disease.
It's debilitating. It's psychologically debilitating, because, you know, if I hear degenerative disc disease, that sounds horrible. You know, most people like to think of themselves as young, and that's just like, you know, it's the person who, you know, you mentioned there's no direct cost, but there is kind of a psychological cost, because now I have this label of degenerative disc. So now I'm going to go on Google, and I'm going to go on YouTube, and I'm going to start finding information that may or may not match exactly what's going on with me, because I mean, face it, a lot of these blog articles and videos are made very generically, because they don't know who's really watching them. So they're not specifically for you. And you start an exercise program that a lot of times I see it exacerbates, or at best doesn't really help the person along, because it's very non-specific information. So and then they start looking for providers, and they tell them, I have a degenerative disc. The provider says, okay, I'm going to do an assessment for a degenerative disc, and I'll give you a treatment program for a degenerative disc. I can't tell you how many times people have come to me who said they have had a degenerative disc, show me imaging for a degenerative disc, and my assessment says, and you know, Bo and I, you know, we can just briefly say, if you have a degenerative disc, generally the treatment program is mostly flexion based, right? It's open up the back, open up the joints. And I've seen so many times with people who've been through that kind of protocol not get better, and I put them through full extension. You know, I have them go in the opposite direction that every textbook tells you not to go, and all of a sudden their symptoms disappear, and they feel so much better, and they're walking. And you know, again, it takes clinical reasoning to be able to come to that determination, and not just take a piece of paper and someone's word for it.
Right. Yeah, for sure. I want to move a little bit away from the whole MRIs and X-rays bit, but I think we hopefully got that message through to anyone watching, listening. And if you know somebody who's going through that, the main thing to say is you are not your image. You know, there's more to it. And again, finding, and this takes me to the next thing of kind of the top things that I think somebody who is starting to have pain, chronic pain, should think about. So the first one, and this is from the graphic I sent you the other day, of number one, self-management. So, you know, there are things you can be doing. And again, whether you go on the WebMD pathway or you go to that doctor and they say, hey, like, just take it easy, rest. And again, that might be good to say, stop running 5 miles a day, because maybe that is what's causing it. But to say rest completely and just sit on the couch is probably not the best thing. So the self-management is generally going to say, increase activity in a safe way, find the things that you can do, and then decrease passive treatments, which again might be acupuncture, might be massage therapy. And I'm not saying don't do any of those things, but realize that those things are passive, meaning you're not doing anything. Your body needs to move, your muscles need to move, you need to drain your lymph. There's all these different physiological things we could talk about. So that, yeah, self-management, what's your take on that? How do you incorporate that before somebody even comes to see you?
Yeah, so you've got to step back, and again, you've got to look at chronic pain from the lens of the whole person and not just a person with a back problem. So a person with a back problem might just have stiff muscles or a joint problem, but a person with chronic pain, we're talking about a systemic thing now. We're talking about something that affects kind of the nervous system. So you got to look at the person, their anxiety level, their stress level, their nutrition, their sleep, quality of sleep. And you've got to, and again, their beliefs, right? Their fear of pain, fear of movement, fear of re-injury. And you have to address these things individually because they all play a piece into your experience of pain. And again, I use this term very specifically. It is an experience of pain because everybody's experience is very unique. You can't say that I feel your pain or I know what you're going through because you really can't, right? Everybody's pain is very, very unique. So I always say if you have someone who's anxious and nervous about movement and worried about losing their job because of their back problem, let's say they've got financial stress, they can't keep up with what they need to do at home, and they're not getting good sleep at night, all of that's going to increase their experience of pain. So I could be doing everything that I can think of in my toolbox to help someone with their back problem, but if none of these other areas are being addressed, we're not going to make that much progress. So mindfulness, wellness, changing thought patterns, changing that anxiety level, giving them other tools and methods and pathways to think about their problem and start changing it from a more cognitive level. Because again, that experience of pain starts from the top down, and once you change that, you start changing that experience of pain as well.
Yeah, I love it, and that kind of takes me to, it's never too early, it's never too late. Like it's not, you might be 90 years old, and it's not too late to start something. Whether and not just talking about chronic pain, but to start a fitness program, to start moving better, to start getting your body better. And again, when I think of these things we're talking about here, I think of somebody who continues to be in this cycle of worse, and things just again being bad. And when I work with people on nutrition, which I do, I think of every meal you have, you're either doing something good for your body or you're doing something bad for your body. You're not likely staying the same. And if we have 3 meals a day, 21 meals a week, if you have 11 bad meals and 10 good meals, and I don't necessarily like to say bad and good, but you're at -1, if we did the very simple math. But the point is, if we can even switch that, to 1 more good meal and switch it to 11 good and 10 bad, at least we're moving in the right direction. So that's actually my my Instagram post today. Mondays is Movement Monday, and my big theme or rule today is better is better. So can we move in the right direction? Can we start moving into something, whether it's taking you from the couch to just get up and do a 10-minute walk after every meal,
Yeah, and again, just piggybacking off that, pain at the core essence of it, it's a learned experience, right? I mean, I mentioned I have a 1-year-old, and just this past Saturday, we noticed she's just got a little blood on her finger. She cut her finger. She stuck her finger in a air vent when we weren't looking, and it was bleeding. It was pretty bad. And she was just staring at us. She wasn't crying. She wasn't in pain because she really had no prior reference of what that is. If you ever look at a kid when they first fall or hit themselves, or hit themselves, my daughter's also learning how to walk, so she falls down pretty often. First thing she does is she just looks at you and she's stunned. She's just waiting for your reaction. And if you're anxious, nervous, worried, then she'll pick up on that. And the next time something like that happens, her brain will just go back to the last time this happened, memory bank, this is the reaction, so this is going to be my default reaction. So they pick up these cues, and pain is a learned experience. And you can't really unlearn something you learned. So years, 40 years, 50 years later, when you have this pain experience, you can't unlearn pain, but you can start modifying it. You can start modifying your experience of pain. You can start modifying your movement patterns and your thought patterns to modify your behaviors, to modify that experience of pain that you're having. And that's really what we're after when we're looking at people who have longstanding aches and pains.
Yeah. Yeah, I love it. Yeah, that the child example is a powerful one for sure. Yeah, I remember. I don't have any kids, but my nephew, same thing. You know, he fell down. I looked at him and I was like, "You're good." He was kind of like, "Oh, okay." He brushed it off and kept playing. And there was another time when, yeah, somebody came running over, like, "Are you okay? Oh my God!" He starts crying. But yeah, that's totally an interesting thing, and it's also interesting. We are dog parents. My dog is. I don't know if you might have even heard her snoring at some point. She's napping down here next to me. But it's interesting as dogs, I don't think have those kind of. Well, they pick up on energies too. So it's been an interesting thing where I think maybe they even pick up on energies a little bit more when my wife's a little bit more anxious around different scenarios. The dog is a little more anxious. I'm kind of like, whatever. Let's keep walking. Like, you're fine. You know, I guess I'm the bad guy or the tougher parent, but yeah, it's an interesting thing that I don't know if you have a similar thing with human children, but
Absolutely, they pick up on your energies and your vibes as well. They're very intuitive.
Yeah, definitely. Yeah. Definitely. So one of those was what we talked about for anyone dealing with issues of self-management, being more active, being less passive. Number 2 was get a custom plan. So, you know, the sooner you can do it, and you said this earlier, and again, my wife who's a sex and relationship therapist, that's something we very much connected over the fact that when it comes to, you know, a lot of people come to us only when it gets really bad. Same thing with relationships for her. Of those things have been building up for 10 years. You know, whatever it is, like, yeah, he's never once put the toilet seat down for me, or he always forgets anniversaries, and I've let it go, but it's been kind of gnawing away, whether that's an emotional thing, a relational thing, or physical of, yeah, every time I run, I have this thing going on, but I've been ignoring it and just keep running. So yeah, so it's getting a custom plan that keeps in mind your biomechanical, meaning your head to toe, what's actually going on. Maybe your hips are tight and they're, you know, we can go deep into the mechanics of it all, but you know, it should be a plan designed for Alan or designed for, you know, Mary or whoever it is. The social component of it all. So biopsychosocial is the fancy term. And then, yeah, get individual approach for figuring out, you know, how to address this chronic thing, how to address these aches and pains. If you don't have that, you're just going to keep chasing symptoms that I think we alluded to. So yeah, any thoughts there?
Spot on. Absolutely agree. I get, again, a lot of times people come to me and they've got this pre-printed photocopied sheet of exercises that they got from their last provider, or if it's post-surgical, maybe they got it from the hospital. And it's almost as if, you know, they expect everyone with back pain, if they went through these same 6 exercises, their pain would magically disappear. And it's just not like that. You need an individualized approach, an individualized exercise program, and built up from scratch specifically for you, for your problem, and starting where you're at, meeting you where you're at now and leading you where you want to go. So first thing I do when I see those sheets is I tell them to just toss it. We just start from scratch and we build exactly what they need at the time. Absolutely.
Yeah, I love it. And then our third step that we kind of had in our infographic was the behavior change and active lifestyle, and incorporating that in. So yeah, it can't just be these sheets and I did my physical therapy for 6 weeks and I did these 3 exercises daily or whatever. It's building in these habits again of like, I am an active person, a lot of goal setting going on right now with the new year. Things that I've been working with folks on is, yeah, building in systems of every morning when you wake up, you're going to grab you know, drink 8 ounces of water, or, you know, whatever glass you have it ready the night before, put a little lemon in it, put a little salt in it, boom, you've set your day the right way. Everything else is a win. Whatever it is, those little habits. Or yeah, every time I finish a meal, hopefully with your family, whatever, you're going to go for a 10-minute walk, and just like whatever that habit is. And the same thing with again, dealing with some of these chronic pain things of, if you're doing your exercises or what have you, your home exercise program, as we call it in the profession, it's also, I'm going to do some breathing before and think about, whatever it is, I'm going to open things up. But whatever those habits are, so you mentioned the multidisciplinary approach. You guys have psychologists, you guys have nutritionists, you have a life coach on staff. So how often does that get integrated? Is that for every single person that comes to the door? How does that work with you guys?
Again, it's individualized. It really depends where the person is, right? So if we screen them and there isn't much anxiety or psychological issues that need to be worked through as far as pure avoidance, then however, maybe there is just behaviors that need to be modified, then we'll make a recommendation to a life coach to start grooving in some better habits and help them restructure their day, and tips on mindfulness and things like that. Or if it's nutrition, if we identify that nutrition is an issue, then we'll make a referral to the nutritionist. But it really all depends on, again, that customized approach and screening them and appropriately and finding out where they're at now and where they want to be. So yeah, I mean, I'll borrow a term. I love your term of 1% better, right? So if you just aim at 1% better by the end of the year, you're how much better?
It's not 365% better. I have that infographic somewhere, and it's I forget the exact number, but it's like 2.77 whatever it is from 1.0. So I guess it's like 277%. It's not, yeah. Anyway, math is fun, but it's not down, but it's sloping up.
Again, it's a gradual change, and then you groove that year after year. You're looking at a totally different person, right? Yeah, and the quote there is also, especially again with New Year's. We can accomplish a lot more over 6 months or a year. We tend to not realize how much we can accomplish over a longer period of time. We don't like to think in that way, our brains. And we tend to think we can do a lot more in 1 month, 6 weeks. We like to think of that short term. And also within the profession of physical therapy, we set short-term goals and long-term goals, and insurance companies say, they want to make sure you're continuing on this. But it's something that kind of drove me crazy about the profession, because you have to say, they'll be independent with home exercise program. You get into these kind of generic things that you put in for the insurance company's sake. But it's what is really meaningful, and how do we create, again, lifetime change, not just get you out of this pain right now. And get, if we need to get your knee, if your knee is kind of stuck to whatever, I'm having trouble with the camera here. But if your knee is stuck and we just need to get 10 more degrees, or we need to get full range of, I'm losing the camera. Yeah. We need to get full range of motion. Then, it's easy to say, okay, cool. Yeah. Next time you come in, we can do a little bit more. But for me, when I'm working with somebody who's got, a total knee replacement or whatever, if we're not building habits, so it's not just how far do we get your knee, it's also, did you do, 30 minutes of X, whatever it is, getting on the bike today? Did you complement in these anti-inflammatory foods? Because we know that, after a total knee replacement, you probably have inflammation going on. So we need to start bringing that down. So how did we manage that? Did we put in a system, whether it's breathing, whether it's laying with your leg up on the wall for 10 minutes, pumping that fluid out of there? Did we actually do that? Was it active? Was it passive? How do we put all that into place? So I'm going down a weird path, so I'm going to bring it back to, unless you have anything else on that, I wanted to swing over to, I think it's super interesting, some of the differences you've noticed, other than the super obvious differences between Canada and America, of the healthcare systems and maybe the patients. Is it all kind of the same at the end of it? Obviously, so I'll say what I know about the Canadian healthcare system. I've never lived in Canada, but it's a nationalized, socialized. Again, we just had these elections down here, and a lot of political stuff in America, and people are scared of socialism. And without going down that path of what does that mean and all that, but basically the country pays for everyone's healthcare. If you have money and you want to pay cash base, right, you can kind of go ahead and do elective procedures on your own, and people are going to pay for better provided. But I'll let you tell. It's each province runs their own healthcare kind of program. So in Ontario, it's called OHIP. It covers your general medical costs, your family doctor, vaccinations, specialists, surgeries. It doesn't cover extended health, what's called extended health benefits like physio, chiro, massage, acupuncture, nutrition and things like that, orthotics. So for those type of services, a person would either pay out of pocket, or many people have employer provided what's called extended health benefits. So they have health insurance through their employer to access these other benefits, which pays varying amounts, between co-insurances or full payment and things like that. So that's kind of the system here. And then obviously with a socialized system, not to get too political, you're obviously still paying for it in higher taxes. So the phrase is there's nothing free, but at times it's convenient, and at times it's very frustrating because there is a very long wait to see a specialist. There is a very long wait once you've seen the specialist to get that surgery scheduled. So I think I read a stat that hip replacements right now, it's a 2-year wait list. I broke my wrist a couple of years ago, and I re-sprained it. It was January of a couple of years ago, shortly after I moved here. So I guess it was 2016 or 17. And then that was January. In August, I get a call from a doctor's office calling to just book me in. I had no clue why they were calling me or what they booked me in for. And I said, I don't understand. Who's this doctor? They said the doctor's name. I've never heard of this doctor. What do you do there? We're a hand specialist. I said, oh, well, my hand's been fine for 4 months, 5 months. He said, well, we got this referral from the hospital you visited back in January. Wow. I said, oh, well, I mean, thanks, but it's not an issue anymore. Right. But unfortunately for a lot of people, during those 9 months waiting for that appointment, things are just oftentimes spiral downward and get worse and worse and worse. So that's the frustrating part about the system is, I know working in the US, a lot of times you can see a specialist directly without even a referral, depending on the insurance. Or if you did need to go through insurance, you'd kind of get that appointment pretty quickly. So those are the kind of the major differences.
So which one is better? No, I'm not going to put you on the spot with that. But I'm curious, actually, with that system, has there been change with maybe push to virtual visits since COVID happened and the world got locked down? Has there been?
Yeah, for sure.
Yeah.
For sure. I mean, I think the whole world has really shifted to, and people are becoming more and more familiar and comfortable with online visits. Our family doctor won't see anybody in person for the kids. Every visit is virtual. A lot of the family doctors here are the same. They've moved to virtual, so people have gotten used to it. At first, when I said we do physio virtually, they just didn't understand how that would work because they perceive it to be such a hands-on profession, and I'm a manual therapist, so it is hands-on. But again, when we're working with people who have long-standing aches and pains, the best thing you can do is get them moving and not put maybe your hands on them as much and give them passive treatment. So for my clients, it really fit very well to do virtual or telehealth because it's just me and you talking and taking you through exercises and watching you do the exercises and correcting the movement patterns and moving it on from there. So but yeah, there was a big push here obviously during COVID to move to virtual and initially dissuade people to come into the office unless it was emergency. But at this point it's we have these strict protocols and guidelines in place on who we bring into the office and who we'd rather do virtual visits with. Mm-hmm, mm-hmm.
Yeah, I'm kind of been I've been doing online coaching, especially in the fitness space for a few years. So this kind of change in the landscape, we can say, made the transition easier for me. And the way I think of it is movement literacy. So it sounds like it's kind of in line with what you guys do, but I think of, how well do you hinge? I want to look at your movement patterns. How well do you squat? How well do you push, pull? We can look at all these different simpler ways to break down the body. And some people just don't move that well. So when I say movement literacy, I'm referring, I analogize it to, the same as like reading levels. So some people in school, you're only reading at a 5th grade level. you're reading at a college level, you're ready for this next thing. So, but that's the same way it's subjective. So the expert, is judging how well you're moving. And I say, hey, I'd like to see you clean that up. Or if I think we need to change you doing that, do you feel the difference? And we can totally do that virtually. And, in a lot of ways that we can accomplish a lot virtually. And I do think that hopefully the way things have been going, it's been getting easier to do that. I think people are accepting a lot of that as well, as it's become so commonplace. So it's an interesting thing for sure.
Yeah.
Hey, Cutthroat 03. Hey, you doing, guys? I don't know who that is. Do you know who that is?
Don't know.
Ask a question. You can ask a question, sure.
I love breaking it down. I love taking these complex movement patterns, breaking them down, and then building them back up. I call it the Mr. Miyagi, Karate Kid approach, where the client has, may not understand why they're doing, waxing the car or painting the fence, but at the end they're able to do these complex movements when it all gets pulled together, right? Yeah.
Right. Okay. So we have an interesting comment in the comments. They're throwing me off a little bit, but anyway, what else do we have on chronic pain, changing things for sure? Have you seen the Cobra Kai?
Love Cobra Kai.
Yeah.
Halfway through the 3rd season. Same.
Really
enjoying it.
Yeah, man, it's been fun. It's been fun nostalgia. I think if you hadn't grown up with the original ones, like my wife did not, I think she's not going to enjoy it as much. So I haven't made her watch it with me, but I've been enjoying it.
We didn't realize how big it was. I thought my wife and I thought we were the only geeks watching it, but with 3 seasons and #1 on Netflix, well, I figured a lot of people are into it. So yeah, I'm loving it. Big nostalgia.
Yeah, man, for sure. And so, anywho's it's cool, man. I wanted to see if anything else. We've gone close to 50 minutes. Anything other big things you want to leave the folks with? Aches and pains. Again, my saying there that I don't know. I think I mentioned a little bit, but yeah, listen to the whispers before they become yells. So if you have something going on, a little bit of ache and pain. If you're playing basketball, every time you play basketball, you feel a little whatever it is. Just try to pay attention to that. Check in with someone like Alan or myself. Check in, ask the questions. There's plenty of free stuff online like we're doing right now. And so check in with that. Yeah, go ahead.
I think the #1 thing really is to get educated and understand, do your research, ask around. At my clinic, we don't, if you were to call my office and try to book an appointment, we wouldn't take you right away. We'd book you in for a free consult first to figure out if, what's going on and if it's something we can help you with, because we always want to make sure that you're matching the provider with the person. There've been many times where I've seen the provider and the patient really don't sync as well. And so, as a person with looking for a solution to your problem, just like you'd interview maybe your accountant maybe or whatever, just make sure, do your research, find out more about your problem, ask around, and we always offer those free consults to just really open up and give you an opportunity to get all your questions answered before you decide to, and give you more information about your problem before you decide to do anything else.
Yeah, and it's easy to, I think we joke around inside the medical profession around like people going on WebMD and the person in the comments is asking about possibly having colon cancer and asking if we can diagnose that. So that's not the right way to do it. You guys got to check in with a provider, set up a proper visit, and see what's going on. And that's the thing. You can fall down that path of Googling things and saying like, oh yeah, my elbow hurts, and maybe it's chronic tendinitis or tendinosis, depending on how much intensity you're getting. And then what's the way to fix that? Is it ice? Is it, the complex answer that I think that's one of my specialties, is helping people with rebuilding their tendons. But that takes a commitment. It takes a conversation and then buying in to, for the next 12 weeks, I'm going to take you through 3 times a week, slowly loading it. And you're not really doing anything else for those 12 weeks along the lines of that tendon. And so,
Right.
but that to me is the right way to build that up. And we have to be on the same page as that, but it's not a matter of just going out and dealing with that, you know?
Absolutely. I agree with you. Yeah.
Yeah. It's this, you know, modern world we live in. Everyone's jumping on WebMD, and I don't think we can answer Cutthroat's question there, that a 17-year-old can have colon cancer. I think that's their
I
question.
would say call your doctor for that one.
Yeah, exactly. That's exactly what I put in the comments is, you got to check in with your medical provider. Unfortunately, we can't really figure that one out for you. But yeah, so we'll wrap it back up, take it back to here. So Alan, where can people find you? Where are the best places?
Yeah, we have our website, www.premierspineandsport.ca, and we're on Facebook and Instagram at Premier Spine and Sport.
Awesome. And Premier has that E at the end of it.
It does not have the E at the end of it. Not like the premier of a country, but premier like, you know, the top and the
Top.
best.
Okay. Well, I wrote that down the wrong way. I don't know if you have that spelled wrong on your Instagram. Maybe. Is that possible? Anyway, you are not very active on Instagram. I'll point that out. And
we're going to be changing that this year.
Well, on your own personal one anyway.
We're looking to put out a lot more education, a lot more content to help people along their wellness journey.
Nice. Yeah. And that wellness bit is definitely significant. Again, that's been my focus, and I've shifted from a traditional PT approach to more of a wellness style approach of making sure, if you're not addressing everything, if you come to me with back pain, especially chronic back pain, if we're not addressing your sleep pattern, your stress management, your ability to breathe, sometimes it's as simple as that. And I've had a few people in the last month even that have been complaining about back pain. And I was like, let's just take a look at how you're breathing along our assessment virtually. And it was as simple as, they're breathing up here in their chest. I said, let's try to focus, nothing else. Let's not do anything else and just change how you're breathing for the next couple of days. And that solved 97% of their problems. So it's powerful stuff. But if you're not looking at the whole thing, and it's easy to say like, oh, your glutes are weak, and you know, we gotta get you doing all these different exercises and things like that, and get caught up in that. But if you're not looking at the whole picture, we can be missing some pretty major stuff. So for sure, I appreciate that approach, that directive. Anything else for the people?
No, I always say if the sooner you've got something, and the sooner you seek out help, then the sooner you're going to start getting relief, and the quicker the relief will come. You know, it's like anything else. The longer it's been around, the longer it's going to take for it to go away. So don't wait around.
Absolutely. Yeah, and again, that was the thing. I think I don't know if I drove that home with my wife, that when we talk about patients who come to us, like if we can get them all sooner, you know, instead of 10 years down the line, we'll definitely be. It's a lot easier to solve those problems the earlier you get to them. So, you know, as soon as that check engine light comes on your car, check that engine.
Unfortunately, a lot of people put some black tape over their check engine light and just ignore it.
It's easy to ignore it for sure.
Take it in.
Absolutely. So guys, hopefully you got a little better, 1% better today, along your journey of health, wellness, enlightenment, and we learned something from Alan. I learned a few things for sure. So that's the idea of this podcast is all selfish. Bo knows stuff. Bo knows more stuff now. So, Alan, again, thank you for your time.
Thank you for having me.
I'm going to re-emphasize to our commenter in the comments, go check in with your medical provider. We can't really be diagnosing you over the live internets. So check in for sure. And you guys have a great day.